Good morning.
Good morning, sir.
So after Diwali, we will start our regular sessions of learning. The case study, case processing, case analysis and understanding of the case. So today I have chosen a case of Dr. Vijayakar sir. The case of adenoid. It was treated long back in 2008, 9, 10. But this case gives you some insight into learning. So purposefully I have chosen this for our understanding. So first of all, tribute to our master Samuel Hahnemann, who taught us Dare to be Wise. Second, we take blessings from our Guru, Dr. Praful Vijayakar sir, who teach us homeopathy is mathematics. Special thanks to my mentor, Dr. Jitesh Sosalia. Again, a very special thanks to my guide, Guru, mentor, friends forever, Dr. Suketu Shastri. What Dr. Vijayakar says, I do not see what mind does not know. So, every time when I used to start my presentation, I put this quote. Why? Because something have to be installed into your mind, and if it is installed into mind, then your mental software will work and it runs in a proper way, so that will guide you to the process of curing the case. So let's start the case of a small girl, baby RN, 5 years, studying in a senior KG, a diagnosed case of adenoid. Why I purposefully choose this case? Most of time in our clinical practice, we commonly encounter these type of cases, adenoids, commonly, okay, frequently. So what to be taken into considerations? Very important, okay. So the diagnosed case of adenoids. So chief complaint. So mother told that recurrent cold and cough with a sore throat and fever since 6 months off and on. Okay. She had a nose block most of time, treated with the allopathy. And second observation was at the 5 years of age, her height was little less than her actual age. So this was the observations. In the past history, what mother told is cold and cough 6 months off and on with the diagnosed case of the adenoid. So in the past history, she had a high grade fever, 3 years of the age, treated with allopathy. 4.5 years of age, at the 4.5 years, means 6 months before, she was diagnosed as adenoid. X-ray nasopharynx tell us that it is adenoid. Mildly enlarged, moderately enlarged, severely enlarged, depending upon the case you encounter. So adenoid is like that. So adenoid was found, and she took some Ayurvedic treatment for cold and cough 3-4 months back. The family history: father hypertriglyceridemia. Drug history: at present she was prescribed on the Solving Cold, Panties and Septilin. This is the Ayurvedic antiseptic medicines from Himalaya Pharma. Okay, most commonly used in the children for recurrent throat infections, tonsillitis, or sometimes it is in the adenoids. So this was prescribed. The general makeup, common indications of the case. What we are taking into considerations, the general indication. So appetite, it was satisfactory. She was vegetarian, very fuzzy about the food, and cannot take warm food. So plainly rule out like See, we are very fortunate enough to understand the PQRS. See, we have to understand two things. One is a disease totality and one is the constitutional totality. We have to make two different. Disease totality means the diagnosis of the disease, pathology of the disease, bias on the disease, and the constitutional totality, in which you have to take a 3-point: mental general, physical generals, and general proper. Okay? Or physical particulars. So that has to be counted into considerations. Now physical particular related to two things. either it is related to the disease totality or either related to the constitutional totality. Are you getting me? So this is what you have to understand. She likes sweet, ice cream, chocolate, milk and fruits. Commonly a 4-year, 5-year baby, they like this. Okay. Dislike dal, most common. She is hot and thirstless. Now here we have hot and thirstless and warm food not like. So plainly we have to rule out one remedies. Like over. This position is most important, na? General makeup, perspiration moderate, sleeps for 8 to 9 hours. She was asked about dreams. So mother said that since 1 month she is complaining that she should do this or that. She gets something in her brain and she thought, how will I do that? How will I do it? So sir commonly asked, tell me more about the dreams. So parents said that since last 1 to 2 months she gets up in the morning and says that I get something in my brain. मेरे दिमाग में कुछ आता है that how I will do, मैं ये कैसे करूँगी, and some strange thing keep talking like, for example, my brain thinks that this man is silly, but I know he is not. मेरा दिमाग ये सोच रहा है कि ये पागल है, पर एक्चुअल में तो नहीं है. ठीक है. My brain tells me play, मेरा दिमाग कहता है खेलो, पर I don't. मैं नहीं. Are you getting me? This is something that she wakes up and she had this kind of something happening in the brain. This was something in the case. Sensitive, she is sensitive to tight clothing, smell acutes. Mental makeup. So generally we used to start the whole history. Okay. So mental makeup stays with the parents, studying in senior KG. Mother says she is a very sensitive child. Even she is wrong, then also she doesn't want anyone to tell her anything. अगर उसकी गलती है फिर भी उसको कुछ बोलना नहीं चाहिए. अगर बोले तो वो उसको हर्ट करता है. Clear? Okay. Sensitive to rudeness, start weeping or feels very bad and gets upset. Whenever anything she doesn't like, she will tell her mother. उसको कुछ अच्छा नहीं लगता तो mother को बोल देती है. Not an angry child, destructive or an obstinate child. Once explained, she can understand. So we have directly the yielding type of dispositions we had. Okay. So mother says she was very quiet in her action, but now she keeps loitering. Very much extroverted, mix up easily with the children as well as the adult. It was just 5 years girl. She was always been in an environment which is very much comfortable for her. So generally we ask in which environment she was being disturbed. So mother says she is always in the comfortable environment, so nothing disturb her. Okay. Memory very sharp. She remembers everything, even things when she just at 1 year old. So 1 साल की उम्र में जो उसको हुआ था वो उसको याद है. वो हमको बताती है हम यहाँ गए थे, हम वहाँ गए थे, हमने वो देखा था, हम यहाँ गए थे. हम जब मेमोरीज फोटो देखते हैं तो बताती कि ये तो वो जगह है जब मैं यहाँ गई थी. सो दैट वाज अ वेरी शार्प मेमोरी. वेरी कीन ऑब्जर्वर, वेरी इंटेलिजेंट चाइल्ड. वेरी गुड इन स्टडी, always in a top rank, and always ask mother how did she do. Seeks the appreciation. मैंने कैसा किया है. Almost a small kid always asks for the things. Fear of darkness, approaching child. This was the observation by sir. She approaching the sir, so there was an approaching child. During her fever, she is very dull and feels better when mother is around. Okay. Very talkative and playful child. Can stay out without her parents if she is occupied. मतलब कुछ काम में लगा दिया या कुछ प्ले में चली गई तो मदर फादर के बिना भी वो रहती है. ठीक है. Mother says she has to be given some constructive work and like to be hugged and kissed. Okay. अभी इतना डिस्पोजिशन पे कौन सा दिमाग में दवाई आता है? phosphorus, pulsatilla और
Calcaria mute.
calcaria mure. Very good. Fine. हमें क्या ठीक करना है?
Adenoids.
Adenoids. ठीक है. Fine. और थोड़ा बाकी है. She likes things to be done perfectly, very particular regarding her surroundings. She takes care of her belongings. Mother constantly tell her that you should be like this and not this way. बच्चा ऐसा नहीं होना चाहिए, ऐसा होना चाहिए, ऐसा नहीं होना चाहिए, ऐसा होना चाहिए. ठीक है? She does not get tired easily. Prolonged sleeplessness day doesn't affect her stamina. मतलब सब ऐसा है कि ये रात को लेट तक जागती है, सुबह जल्दी उठ जाती है, फिर भी ये थकती नहीं है. So commonly the child has good energy, energetic child. Okay. So tell me the analysis of the case. This was the end of the case. Now what to be taken into considerations and what is the point of analysis? As a predictive homeopath, what we have to do in this case? How we have to analyze the case? First, the diagnosis of adenoids. What is PQRS in whole case? So what is that? Now you should be very vigilant and finding the PQRS. What Hanuman is the fidelity in tracing the picture of the disease. Sound senses. So apply your sound senses. What is most important in the whole case, and why this happened to the child. Ask yourself. The patient came to you with the complaint of adenoid, but adenoid is more important or something else is more important? Dreams. What happened actually in the dreams? Actually, it happens in the dreams, or it after waking up. Something happening. What is that? What is that things is going on?
Confusion.
Okay, confusions. We can think of that. What kind of confusion? Very good. Fine. So, something is happening at the CNS level. So we need to treat either adenoids or CNS higher version. Because now why this happened? The toxin has gone from throat to somewhere else in the brain. Why it happened? It is suppressed because of Ayurvedic medication. So what should be the treating? What we have to treat? Now what is the analysis of the case? Do we take the disposition into consideration? Because adenoid is a chronic process. Okay. But now this process goes into a higher version, CNS affections, since 2 months. Okay. So, miasm comes and goes, psoriasis, but chronic psora is lurking at the adenoids. Okay. So we have to consider the anti-miasmatic or considering a constitutional remedies. Okay. So for constitutional remedy we have to understand the will, intellect, moral, attachment, sensitivity and everything. The disposition is most important. Okay. So sphere of actions. The sphere of action is CNS and respiratory system. So cold and cough is there and adenoids is there, and this adenoid goes into a CNS affections like neurochemical changes. That is why Sir has taken this as a psoriasis. So child was extroverted, will was very strong, intellect very good, memory very good. So mental makeup. Now what we have just analyzed this. Now we have to analyze the mental makeup in 3 categories. सोरा क्या है, साइकोसिस क्या है, सिफिलिस क्या है. अगर हम ये एक्सरसाइज हर केस में करेंगे तब जाके हमें पता लगेगा कि ये पेशेंट सिफिलिस में से साइकोसिस में जा रहा है, साइकोसिस में सोरा में आ रहा है। नहीं तो हम फॉलो अप में वो जज नहीं कर पाएंगे कि पेशेंट ठीक हो रहा है या डिटोरिएट हो रहा है, क्योंकि हमें पता होना चाहिए सोरा में क्या है, साइकोसिस में क्या है, सिफिलिस में क्या है। ठीक है, सॉरी। सो व्हाट इज द सोरा ऑफ द चाइल्ड? सेंसिटिव टू रूडनेस, कोई बोलना नहीं चाहिए, सेंसिटिव टू क्रिटिसिज्म, और क्या था? सेंसिटिव टू रूडनेस आ गया सर। क्लिंगिंग टू मदर, नॉन कंसेंशियस है, नॉन डिलीजेंट है, और फियर ऑफ डार्क। अगेन फियर ऑफ डार्क इज अ सोरा इन अ चाइल्ड, because for survival the fear is not psychosis in a child, a small child, but same fear if it is there in the adult, then it is psychosis. Are you getting me? And what is that? She is intellectually very high, quick to act. Okay. So this was a sora. What is psychosis? Want appreciation, exactly, fine. Anything else in psychosis? Psychosis में she become very mixing up with everyone, extroverted. Psychosis is extroverted, and she like to talk more and more. Okay, so extrovert and loquacity. What is syphilis? Tell me the syphilis.
Morning wake-up state.
Morning. What was that? You have to understand. Do we consider certain dreams into it? Do we consider confusion into it? Do we consider something else?
So memory active.
Yes, very important. Memory active is very important. A small child of 5 years, they can remember 1 year. At the age of 1 year, she had some experience, and that experience has to be remembered as it is. So this is very important in. So this memory active, what is the memory importance is? It is the intellect. So we are giving importance not to the emotion but to the intellect more. Okay. Hierarchy, that we understand that be extroverted, introverted. So on the basis of we have understand this personality first. Second point, we have to give importance to the will. Third point, we have to give importance to the intellect. Fourth point, we have to give intellect to the moral. Then emotions and sensitivity and attachment. So we consider more is memory. So memory active. Now what happened actually? What is the syphilis?
બે વસ્તુ આવે છે તો એન્ટાગોનિઝમ વિથ વનસેલ્ફ અથવા કોન્ટ્રાડિક્ટરી એક્શન્સ ટુ ઇન્ટેન્શન.
Exactly. So sir took same antagonism with himself, because she said that मेरे दिमाग में ये आता है नहीं, ये नहीं है, ये है. So that means she is constantly antagonized with thinking process of self only. So sir took this rubric, syphilis, antagonism with self, and rightly says by Dr. Raj, memory active. Okay. So now what we do? Just we have to repertorize the case. What is the physical general? So physical general, sensitive to tight clothing, smell acute, hot and constant. कौन सी दवाई आएगी? चल ये रेपर्टेशन करके दे दिया मैंने. We have this much of group of remedies. Opium, lysine, lachesis, capsicum, cannabis sativa, cannabis indica, ovara, menarinum, anacardium, aconitum, and verbescum. अब इसमें हम क्या ऐड करेंगे? इतना ऐड करेंगे. Hot, restless, sensitive to tight clothes and quick to act. Cannabis indica, cannabis sativa, opium, lachesis. कौन सी दवाई लेंगे?
कॉन्स्टिपेशन में थे तो ओपियम नहीं.
Okay, very good.
Religion, conscientiousness, silicea rule out.
Conscientious નથી, non diligent છે, non conscientious છે, silesia rule out. Yes, very good. Quick to act વાળી દવા છે આપણે શોધવાની છે બરાબર. Quick to act માં એનાલિનમ બી આવે. તો એનાલિનમ is a drug remedy. It goes higher into consciousness.
બહુ બધા delusion
બરાબર છે, delusion of persecution and everything. Okay. So cannabis indica, cannabis sativa. Sir always ask cannabis sativa. Did the child have some urinary infections or not? If the child have some urinary tract infection, so directly think of cannabis sativa. Cannabis indica. ये रूल आउट कर दिया. अब दो दवाई में से हमें रूल आउट करना है. कौन सी दवाई लेंगे? Sphere of action has to be most important first. So cannabis act on the sensorium only. So if we give cannabis, it will cover only the CNS state of the patient, not the throat complaint or respiratory or adenoid. Okay. Again, another sensitivity is sensitive to tight clothing around the neck. It is the most common to the orophidias. Okay. So on the basis of this, Lacasis 200 single dose was given. Very easy. How this case is cracked. Now we have to look for the follow-up. So in the follow-up, the weird mental symptoms were reduced. So first and foremost, 6 years CNS has to be relieved. Then at that time, throat complaint has been increasing. And after that, throat complaint has been decreasing. So this was the very important aspect of learning. Okay. So weird mental symptoms reduced, irritability reduced, inflammations of the oral mucosa and lift. What happened? Why this happens? So toxins come from higher center to the lower center. So this is a reversal of SORA. From syphilis to SORA again. Appetite better. Appetite better means the patient was general work better even though inflammation is there. Sleep was good. Slight stomach upset. So sir has given essence. No need to repeat the remedy. Okay. Each follow-up is very important. That is why I purposefully put the follow-up into case. Second follow-up. Skin dryness, lateral side of the eyes, right to left. यहाँ ड्राइनेस होने लगा. ये मुंह का ठीक हो गया. अभी यहाँ ड्राइनेस होने लगा. ठीक है. Appetite reduced, complaining of stomach ache, calf pains, boils on the soul, husky voice. क्या करेंगे? एक फॉलोअप में हमने देखा कि बेटर है, दूसरे फॉलोअप में कुछ तो गड़बड़ है. क्या करेंगे? What we generally do?
Repetition.
Okay. We generally ask about something will happen, nothing will happen. Repeat the dose. This is what the SIRS convictions are never repeat. This is very important. Where we got mistaken. What we do? Mostly the SORA has come back. Again, this was a SORA. Again, husky voice. This is what something that it comes from the higher center to the lower center again. So patient is bettering by self, and toxins come from higher center to lower center. Why should we have to repeat? Just stay off. Okay. Sir always says never repeat. Okay. Kant says go fast slowly. That means रिजल्ट में जल्दी फास्ट जाना है, बट प्रिस्क्रिप्शन में बहुत स्लो रहना है. नहीं करना है. नो रिपीटेशन एट ऑल. व्हाट वी जनरली डू, बॉयल्स आया, काफ पेन आया. काफ पेन इज नॉट एक्चुअली द पेन ऑफ द मसल्स. काफ पेन इज अ फंक्शनल पेन. चिल्ड्रन में फंक्शनल पेन होता है. मोस्टली होल डे चाइल्ड वाज प्लेइंग, एट नाइट child has a cramping. So this cramping is again sora. Okay, this is reduced, but for a slight stomach upset है तो reduce है, it's okay, but it does not causes any difficulty. And dryness again sora at ectodermal level. This was again ectodermal level. So when sora is working on, we have to put our hand off. No repetition. We do mistake here. We generally prescribe again single dose here, and the case is spoiled. Okay. Third follow-up. Why this is follow-up is important? Because most of time you have a short remedy. First prescription, you are right. Your follow-up is also going well. And the day when you find something, you repeat and you do into mistakes. And land into the process that अब patient ठीक नहीं होता है. Same medicine, no higher dose, lower dose, ऊपर नीचे बुद्धि करी करो. Patient was going to chaos. Okay. Now, after 2 months, she had a throat irritations, hoarseness of voice, cough, but no fever. Same. Sora is going on. Son has given SL. After 4 months, so it was December to April. Again, she had a cold coryza, pain in abdomen. Behavior was better. Voice is husky. Remedy given. So in this follow-up you understand कि यहाँ पे repeat करना नहीं है, पर एक follow-up ऐसा है जहाँ हम सबको लगता है कि हम repeat करेंगे और करेंगे, तो गलती यहाँ होती है, तो problem again start. December 2000 again appetite reduced. Patient has cold and cough. After 4-5 months, patient again came. In between, no remedy was prescribed. SL only. Spoke to pediatrician. उसको सर्दी खांसी हो गया. Pediatrician को बात किया. She advised syrup, and after that, again she started that type of thoughts. Okay. तो उसको वापिस वो सर वो होने लगा है. अब क्या करूं? सो मदर को पता चल गया कि सर ने बोला था कि ये मेडिसिन की वजह से हो रहा है, इसके दिमाग में कुछ टॉक्सिन जा रहा है, तो मदर स्टॉप द मेडिसिन. आफ्टर 3 days ऑफ स्टॉपिंग द मेडिसिन, शी स्टॉप टॉकिंग अबाउट हर बैड थॉट्स. जो थॉट्स आते थे वो बंद हो गए. ठीक है, क्या करेंगे हम लोग? चल देखे आया था, एपिसोड आया था, सप्रेशन हुआ है, क्या करेंगे हम लोग? What we do generally, this is what something when this case appear to us, what we generally do.
Repeat.
Again we do mistake here. We repeat. What sir said? But Adenoid what drill you. So what sir says? Do not prescribe anything. Wait and watch. Remedy given was SL. What we generally do? Repeat that. So 2 mistakes we have done in the following. I have purposefully taken this case because of this case frequently encountered in our clinic. Adenoids. And what we generally do? Repeat. But sometimes repetition is not needed. Our body is taken care of everything. What Kent says in a preface, we do not cure. Our medicine do not cure. Our medicine just stimulate the vital force, and vital force take care of everything. It was written in a Kent preface, repertory preface. Okay. In the last para. So what sir always says, we just stimulate the genes. Genes will taken care of everything. Okay. So this was happened. Again medicine has stopped. So body tried to throw out the toxins again. And okay. But this was relieved. So remedy prescribed was December follow-up, worseness थोड़े दिन अच्छी रहती है, वापस थोड़े दिन हो रही है, आना जाना, स्टमक अपसेट, कोल्ड एंड कफ, कभी सर्दी कभी खांसी, बट एडिनॉइड हैज डिक्रीज इन साइज. तो एक्सरे पीएनएस जब करवाया तब पता चला आफ्टर 1 year of follow एडिनॉइड हैड reduced in. What we do, इंस्टा पर મૂકવા માટે 3 મહિના થાય એટલે આપણે પેશન્ટને કે એક કામ કરો ને એક એક્સરે કરાવી લો ને જોઈ લઈએ. Unless and until we know about the miasmatic reversal, we can think that this patient is going towards syphilis to psychosis, psychosis to SORA. So when the SORA comes, wait and watch for a certain days, absolutely resolving, then and then advise investigations so that you can get the right result. Otherwise, you are mingled with the process that the patient is going towards, and you repeat, or you either change the remedy because after 3 months you didn't find any change in the X-ray. So what you thought, my medicine was wrong. Okay. So be careful. So small silly mistakes what we do in our practice is like this. Okay. Talking is better. So remedy given was SL. After again 3 months, rash all over the body. So what is that? Very important. Sir always says SORA has to come to the skin only. Unless and until SORA नहीं आता है, you are in the wrong place or your prescription is wrong. Okay. So rash. अभी ये rash आता है तो हम क्या करते हैं? सल्फर. आखिर में सल्फर तो देना ही है सबको. पूरी दुनिया सल्फर से बनी है, पर पूरी दुनिया को शुरुआत भी सल्फर से करते हैं और खत्म भी सल्फर से. ठीक है. What we do generally, rash all over the body. हम क्या करते हैं पेशेंट को? ठीक है. No bad thoughts. अभी वो thoughts नहीं आ रहे. That means brain is clear. Now toxins come to the surface. So sir was very sure that my remedy is right. I do not have to repeat anything out of it. Okay. Occasional complaints of cold and coryza. It is not something that our body is taken care of. And the husky voice was reduced. So what is the process? What do we have to do? इलाज के लिए क्या करेंगे? मैंने बता दिया है कुछ नहीं देंगे, पर हम लोग क्या करते हैं? Again we prescribe something out of it. Either the same remedy in a higher potency because SORA बाहर आ रहा है, or either we prescribe a sulfur, anti-SORA, end the case with the sulfur. ऐसा लिखा है बड़े बड़े लोगों ने. So what sir has given? SL. Because sir always says there is, if the constitution is taken care by certain medicines or the constitutional medicine or a genetic stimulation, then no need to give any of the sulfur or anything. It is very clear cut. Okay. Our master has said that sometime you need a sulfur at the end of the treatment or end of the case in our olden books. But sometime it is also written that it is a condition. Sometime it is not always. And what we take into message, always. Take it as a granted. We become lycopodia, presumptuous. Okay. So this is what we have to understand in this case. So this case purposefully put that you can analyze case very easily. You have prescribed very easily. But what we do mistakes in?
Follow-ups.
In the follow-ups. Most of time in our clinical practice we do mistakes in the follow-up. So this case teaches us that follow-up is very important and you have to look for the miasmatic reversal. You have to look for the patient's betterment and you have to look for when to intervene and when not to. Okay. So unless and until patient is curing herself, it took almost 1 year, 4 months, 5 months. Okay. So this is not a short span of the. Even in organon it was written that in an acute disease, the disease will recover soon. But when a chronic long-standing disorders, it take longer time to cure. Clear? So that is what you have to understand into the case. So thank you so much. This was a short case story and learning for today's sessions. Thank you all.